Hi guys, welcome to my YouTube channel. If you're new to this channel, if you're seeing my face for the first time, what are you waiting for? Please subscribe. In here we discuss about nursing tips, health tips, entertainment and other things, So in today's video we'll be talking about diabetes mellitus. Ndị Igbo na-akpọ ya ọrịa sugar. So this diabetes mellitus is characterized by hyperglycemia, which means high glucose or sugar in the blood. So, and it kind of causes abnormal carbohydrate metabolism. And it's being caused when there is deficiency of insulin, that is no insulin or few insulin in the bloodstream. Just, remember this keyword, insulin. What is this insulin and why is it so important? This insulin is a hormone which is produced by the beta cells of the pancreas. It helps to transport oxygen to the various body. There's a motor that carries oxygen, organ, the adipose tissue or any other part of the body. Or say, there your glucose that we will use, for energy today. This insulin is glucose sharer. It carries the glucose from the bloodstream to different part of the body. So before we dissect, this diabetes mellitus, let's look into a unique organ called pancreas. So this pancreas is so unique because it has dual function. It has endocrine function and exocrine function. That is, it plays a part in the digestive system and also in endocrine system. So the pancreatic juice help digest, fatty food in digestion. So we are not talking about digestive system, that it has some gland like the pancreatic islet, that is the islet of Langerhans. We have the alpha cells that produces glucagon. We have the beta cell, the almighty beta cells that produces this insulin, and we have the delta cell that produces somatostatin. So all these things that they produce helps in glucose homeostasis, that is the balance of glucose in the body. Back to diabetes mellitus. So having known this pancreas and its function, so because we are talking about diabetes mellitus, what we concentrate or what we need is this beta cell that produces insulin, because when there is destruction of the beta cell or anything that will depreciate or decrease the production of insulin or inactivate it for it not to carry its primary function, definitely will lead to this diabetes mellitus. So this diabetes mellitus is divided into two categories. We have the primary category and the secondary category. The primary category means as in it just occur, while the secondary category means a disease condition led to it. There is a predisposing factor that led to this or that leads to this diabetes mellitus. So in the primary category, we have the insulin dependent juvenile onset, that is type 1 diabetes mellitus. Here there is no insulin, no insulin. There is complete deficiency of insulin. And what can cause this thing? Virus factor. When there is presence of diabetogenic virus, which now leads to autoimmune reaction. Autoimmune reaction means when your body, when your immune system, your antibody, see your own pancreas as a foreign organism and begin to attack it. So when there is a diabetogenic virus that see this beta cell as a foreign body, or the pancreas as a whole as a foreign body, and begin to attack it. So when the pancreas is being destroyed, so the beta cell will lose its function and there will be no insulin, and this causes dependent insulin diabetes, that is type 1. That means you have to be giving artificial insulin before the glucose will be carried various parts of the body. Second one, under this primary category now, is independent insulin diabetes mellitus, that is type 2. This type 2 now, there is insulin, but it's few. The body can still manage. It's kind of less severe than type 1, which is insulin dependent. So what can cause this thing? Obesity. When there is obesity, the number of receptor, the insulin receptor, say motor now, before motor fit move, it go need fuel. So these insulin receptors be those things where they carry insulin. Then insulin now go and carry. It's just like before traveling, your motor we go to fuel station and buy your fuel before you now carry passenger and go. You have to go. So that is the scenario here. The insulin receptor carry the insulin, then they carry the insulin from the bloodstream to the various parts of the body. Some drugs can lead, most especially steroid. All these steroid can lead to type 2 diabetes mellitus. That is, the steroid will make you to be fat, now obese, which will now lead to diabetes mellitus. The inactivation of this insulin, there are so many other things that can cause it. So let's move into secondary category of diabetes mellitus. Here we have gestational diabetes, that is pregnancy leads to this diabetes mellitus, and we have glucose intolerance, when there is all these disease conditions like liver disease, hepatitis, and liver cirrhosis. It tends to lead to diabetes mellitus.